I'm excited about our presentation today, and I appreciate the opportunity to be able to talk. We're going to be talking mostly about the Oncology Care Model, which is an alternative payment model that the Center for Medicare and Medicaid Initiatives has been testing and developing over the past several years in the oncology community. Now, first of all, we're really excited about this model because it allows us to transform our practices so that we can improve the quality of care that we're delivering to our cancer patients. Now, it's not been an easy road, and the many things that we will be talking about during the presentation are, we're going to give some background information on the model overall so that the audience can have an understanding of what it entails and what the practices have actually had to do, change, and implement in order to be able to meet the criteria for the model, in order to take better care of patients. We're going to address a lot of the issues that have developed because it's an extremely complicated model. Cancer care overall is complicated in the first place, but when you try to model things, when you try to put things together and compare them nationally, it gets even more and more challenging. So the more we learn, the more we realize we need to refine the model itself in order to have a better understanding of the data that we're receiving. The data that we get is only as good as the data that we're putting in. And so we're continuously working on refining the process so that we can make it better, we can make it successful, we can improve our care, and we can do a better job of trying to provide value-based care. And that's very important given the era of medicine in which we're at, where we're getting better treatments, but the costs are still getting higher and higher and higher. We want to make sure we're doing the right thing for the patients. So we want to make sure we're giving them value care and just not treating them, and that's very, very important. So we're going to go over all of the things that we're also trying to work together with the Center for Medicare and Medicaid Initiatives so that they can improve the current model, make it better for the practices, and make it better for the patients. And then I'll sort of just be laying the groundwork for another discussion that happens right after mine. It's what we're doing to work on the next iteration of the Oncology Care Model called the Oncology Care Model 2.0.